Okay, good evening, everyone. Thank you so much for joining this session today, and I am being honored by Sir to introduce him, though it is very difficult to give an introduction for him, but I'll do my best. We have today with us Dr H.K. Chopra, who is a chief cardiologist at Moolchand, Medicity, New Delhi. He is the president of World Wellness Foundation. He also is the president for World Heart Academy, and he's the country head for American Heart Association. And we are privileged today to have you here, sir, for the virtual session, wherein he's going to share the tips about managing stress during Corona crisis. So that is the topic for today. So I would request Dr. Chopra to take over from here and give us the insights of how we can manage the stress. Thank you.
Thank you, Sorji. Mr. Ajay Jain, President. Mr. Akash Khush, Vice President. Secretary and Treasurer, Mr. Bhushan Dewan. Mr. Parikshit Chopra, Immediate Vice President of BNI Champion Gurgaon. I am overwhelmed and really delighted indeed to be here this evening at 4 o'clock and sharing my views on a very hot topic today. And the topic is very well known to you, how to manage stress during Corona crisis. I will be dividing my talk into two components. The first component is Corona crisis, and the second component is how and what we should do to manage this stress. But before these components, I will start a clipping from Gita in 90 seconds, and I think this is very important to understand. Bhagavad Gita in 90 seconds. It says, wrong thinking is the only problem in life. Right knowledge is the ultimate solution to all our problems. Selflessness is the only way to progress and prosperity. Every act can be an act of prayer. Renounce the ego of individuality. Connect to the higher consciousness daily. If we connect, no stress. Live what you learn. Never give up on yourself. Value your blessings. We are so lucky to be blessed by the God. See the divinity all around you. You're surrounded by divinity. Have enough surrender to see the truth as it is. Absorb your mind and heart in Supreme Lord if you want to be happy. And you must have a total detachment from Maya. Live a life that matches your vision. Give priority to divinity. Divinity is supreme. Being God is a reward in itself. Choosing the right over the pleasant is a sign of power. Choosing the right over the pleasant. Let's go and let's move to the union with the God. These are the two teachings of Gita. I am sure if we practice it, we are going to be very happy and we will not feel this as a panic at all. What is the scenario of coronavirus? I'm sure you all know it by now that it has touched 2.1 lakhs in the world, the scenario, out of which 3 lakhs are almost 25% of the population in the world which is suffering from corona is in the United States. The mortality, you see the global mortality, it's about 5.4%. But if you see the mortality highest in the world is in Italy, which is 12%. And the second highest is in UK. It is almost about 10%, and 9% we see it in Spain, and following this we see in Iran, and we see in other places. And the lowest mortality is in Germany, which is 1.5%. In India, it is 2.2%, while in place like China, it was 4%. The latest figure, which I just saw half an hour back, in India, there are 4,000 people suffering from this entity. And the death rate is about 109 so far. That means the mortality is almost 2.2%. Now, what is the mode of transmission? Where was it born? Wuhan was the country from where it originated, and it is known as corona because it is a crown-like. And the mode of spread is initially from bat to human, and now it is human to human. And the mode of spread and the route of spread is usually in asymptomatic patients who have no symptoms. They are the most dangerous because they are carriers, and we don't know who is the carrier. And second is symptomatic, people who are suffering from COVID. The usual route of transmission is through the mouth, through the nose, or the face. It goes to the pharynx, may produce sore throat, and may go to the trachea, and may go to the lungs and cause breathing difficulty. And it is by contact, droplet infection. There is no data to say that it's airborne, no aerosols. It is only by droplet, and these droplets are expelled. This virus is a large virus, and it can travel a distance of 1 meter. It cannot go beyond 1 meter. That's why we say that we should have a distance of 1 meter. And then it stays in the hands for about 12 minutes, while over the smooth surface, it can stay on for about 12 to 14 hours. And in the porous surfaces, it can stay on for 8 to 10 hours. Recently, data has come from Italy, where they found the virus was also on the shoes. So the advisory was from Italy that the mortality was high there because people were not trying to trying to take care of the shoes they take home, and that may be one of the mode of transmission. So in India now, people are keeping the shoe racks outside their houses, and they are trying to be as protective as possible. When I go to the hospital, I clean my stethoscope, my pen, my BP instrument, even my wristwatch. Everything we take care. Oral hand hygiene, respiratory hygiene, and the overall hygiene is the need of the hour. The signs and symptoms are very, very clear that the cough is dry, associated with a very high grade fever and breathing difficulty, and 30 to 40% of people may have pains and aches all over the body with extreme exhaustion. Ladies and gentlemen, that's very important to differentiate it from other viral infections and to differentiate from allergic cough. They are productive, and you may not have fever. So COVID patients are usually associated with the fever. That's how we screen every patient who comes to the healthcare departments by taking a temperature, and if you find their temperature, they are referred to the COVID. Testing is very important. There are two methods of testing. One is an instantaneous method, what we call the antibody test, where you get the report in 10 to 12 minutes. It is not so sensitive or specific. And the second, which is very important, is PCR, and it is an important method. Indications are any family where there is a COVID patient, all the members should be tested. Hospital, if there is a COVID patient, all the healthcare workers should be tested. Anybody who is traveler coming from abroad, they have to undergo a testing. And the fourth thing, anybody who is coming to the hospital with a breathing difficulty due to a cause, COVID related or non-COVID related, we have to do this testing. Similarly, all the people who are immunologically compromised, like cancer, or they have radiotherapy or therapy, they should also be tested. There are many more indications coming for testing, and I think testing is the only method by which we can know the exact scene of a rising of COVID in India and in the world. What are the preventive measures? You all know it. Frequently hand washing, as I mentioned to you the reason, and the hand washing should be on both the surfaces as well as in between the fingers. And the second important thing is keeping a distance of almost 1 meter, and respiratory hygiene, oral hygiene is the need of the hour. All our surfaces, our offices should have a complete cleanliness. Hygiene is the need of the hour to prevent the rising menace. Isolation is on the top priority. Lockdown, which has happened, Lockdown is the only method by which we can prevent the transmission from phase 3. Phase 3 is a community outbreak, which is having a very poor prognosis. India is not equipped that much what see the Western world or European world, because the need of ventilators is enormous and the need of equipment and the supportive treatment is enormous, and there is no treatment till date. Neither medicine in the form of a vaccine. We are just giving a supportive treatment, and the 80% to 85% they improve by themselves for good immunity. Those who don't have good immunity, especially elderlies after the age of 60, the mortality rate, as I mentioned to you, is rising steeply in the world. What is the treatment strategy and preventive strategies? ICMR advisory, as well as the advisory of Ministry of Health, Government of India, and Drug Control of India has given very rightly, anybody in the family, if have COVID, they should take hydroxychloroquine, SCQS, 400 milligram twice a day on day 1 and subsequently once a week for 3 weeks. If there is a COVID patient in the hospital, where the health worker should take this same dose on the first day twice and subsequently every week for about 7 weeks. The important precaution is, below the age of 15 years, SCQS should not be given to any child. And after the age of 55 or 60, it has to be given with caution because it affects the heart conditions like prolongation of QTC interval or bundle branch blocks. So you have to be a little careful. This is what I want to tell you about the treatment. It has been shown that hydroxychloroquine in one of the France study has been a game changer. It helps in the reduction of morbidity and mortality. It changes the pH of the alveoli and thereby making it alkaline. And that's how the cytokine storm is reduced and people do not go into respiratory distress. So ladies and gentlemen, the second component of my talk is, what is stress? Why the stress is happening? My appeal to all of you as a doctor is, we should try our best not to make corona pandemic as panic pandemic. We should not make it a stress pandemic. We should not make it as anxiety pandemic. And we should not make it as fear pandemic. This is all in our hand. I'm sure you all know the definition of stress. It is a physical, mental, and emotional reaction to daily events of life. I know we all are sitting in their homes. We are working from home. We are not used to indoor culture so much as we used to go to outdoor. So there is bound to be some changes and we have to adapt. We must take it like a challenge. We should not be in fright. We should be in a flight mechanism. And I'm sure there are two kinds of stresses. One is a eustress, which is a healthy stress. We take it in a positive way. And the second thing is a distress, which is a negative way. The negative stress produces some chemicals like epinephrine and norepinephrine or cortisol, responsible for increasing the blood pressure and pulse, and may produce all kind of panic attacks. So it is all in your hand. Whatever is happening, we should be totally contented and change your lifestyle accordingly. We understand that you and me have a physical body and a subtle body and a causal body. The physical body, we have a matter and the energy, and the subtle body, we have mind, intellect, and ego, and we have a causal body where there is a soul and spirit of consciousness. We must integrate. We should learn how we can integrate all the three systems in our body. If you see the consciousness, we all know it is basically a thinker of the thought, an idea generator, which is non-local and infinite field, and it is a radically ambiguous, ceaselessly flowing quantum soup. Ladies and gentlemen, consciousness is like cosmic computer, and mind is like a programmer. And we have about 60 trillion cells in our body. They are the terminals of the cosmic computer. We have to integrate this with the environment within us and environment outside us. Once we integrate that, we can manage stress in a very nice way. Please make sure we don't smoke, we don't take alcohol, we exercise regularly, and we practice laughter, we practice meditation and yoga on daily basis, and take a nourishing diet so that we have a coping capability to face or manage stress in a better way. We See here that the new mantra for a healthy heart or a healthy mind is with spirituality, yoga, meditation. And it should be consciousness based. Consciousness is a field of silence from where you, me, whole world and galaxy originate. We should not be in a sympathetic mode. In sympathetic mode means aggressive, anger, agitation, arrogance, anxiousness, ego and cynical behavior, competitiveness, bigotry. They all increase blood pressure, heart rate, cholesterol, and cause heart attacks and brain attacks. We should be in the parasympathetic mode. Very cool, calm, mindfulness meditation, regular exercise, consuming fruits, vegetables, nuts, adequate sleep, and a disciplined daily routine. I get up early in the morning, same time as I used to get up when I used to go to the hospital early morning, 5:30. I exercise, I cycle, meditate, do yoga every day, and get ready by 7 o'clock. The same way, whatever routine we had before, we should adopt the same routine now. Heart energizing meditation is the need of the hour. You all know that we have 7 chakras, and these chakras are known as energy zones, and they are in the lower part of the back, on the front part, above the umbilicus, in the heart, in the neck, on the forehead, and on the crown. And every energy zone has an importance. An objective is we must energize these zones so that we are balanced. This is one of the pictures. When I used to go to the garden, you can have a garden in the house. Nowadays, I go to the terrace. I don't go to the garden now. In the terrace, I have my 2 grandchildren. I devote 2 hours with them in the morning and 1 hour in the evening. I never devoted so much of time. I enjoy my moment. You'll be surprised. I look at the sky, I look at the stars when I had no time. They are very relaxing. All the 8 limbs of yoga you must practice. Yama, Niyama, Asana, Pranayam, Pratyahara, Dharana, Dhyana and Samadhi. When I say Yama means do's and don'ts, Niyama means self-discipline. And all the asanas, sun salutation, Pranayam is a breathing exercise, Pratyahara, and you should know what type of mind or body you have. Like there are some people who are Pitta. Pitta means very aggressive people. And Kapha, who are imbalanced there, or Vata, are very mobile people. Like for example, if the flight is delayed, if his Pitta is very aggressive, and he says, I'll sue the airlines. When there is a Kapha, he will sit comfortably and play cards. When it's Vata, he becomes very mobile and he makes a call here and there. All 3, same situation, but variation is there. We should always believe not in Dukhira. We should always believe in Sukhira. When we say Dukhira, it means we are helpless, we are worthless and hopeless. Thoughts should never come. We should always be Sukhira in whatever situation we are. Full of opportunities, be optimistic, be excited and be confident and look for the best in the years to come. There are 2 Maha Mantras which you all should know. I practice every day. One is KFP versus BFP. KFP means क्या फर्क पड़ता है, और BFP means बहुत फर्क पड़ता है. Respond but do not react. पहले तोलो फिर बोलो. Sometimes casual use of words can humiliate us. Be balanced. Happiness is everywhere, but there are some people who gives happiness whenever they go, and there are some people who gives happiness wherever they go. I firmly believe past is history. Don't remember it. Future is mystery. We don't know. Present is a moment, and enjoy this as a gift. We see here, your attitude is your altitude. It's your attitude. In whatever situation we are, we should have a positive attitude. Stress management is like a tranquilizer, energizer, stabilizer, equalizer, happinessizer, equipoiser. On the contrary, stress disintegration. That means stress is necessary for us to work, but it should not become negative. It's a toxic emotions, toxic behavior, toxic relationship, toxic consumption, and toxic lifestyle make us a toxic being. I firmly believe inner calmness is the need of the hour, and attitude or gratitude is the need of the hour if you really want to achieve extinction. Bhagavad Gita says, Wisdom is what you are and not what you have. You should be in action all the time and not inactive. Inactive means resting your body. Have renunciation in action and not a renunciation of action. Do the best, let's leave it to God. Exercise every day, in the house, on the terrace, in the balcony, wherever you are. Cycling, walking, jogging, swimming, dancing, cycling are the best exercises. We believe in fitness paradox. Don't take stairs. Don't go by lift or elevators, go by stairs. That's the best way to keep fit. As I mentioned to you, unaccustomed exertion should be avoided, like weightlifting. Breathe in the fresh air. Like I told you, I go to the terrace every day. You should also do the same thing. This is the Lodi Garden in Delhi, where I used to go when there was no lockdown. We should be in the lap of Mother Nature all the time if you want to be happy and healthy. Some people will say they are too busy to exercise. They are suffering from what we call time sickness. We should not do time sickness. We should be free all the moment, like our Prime Minister, Mr. Modi is. He's a brilliant person. He did lockdown well in time and very meticulous, very methodical. Same way our Health Minister advisory is lovely. Exercise and stress management. We can't do swimming unless we have an indoor swimming in our own house. This is very important. Planning of the diet. Very important. Most of us are consuming wrong food and eat food at the wrong time, at a wrong place, in a wrong dose, in a wrong environment. And we should know omega-3 fatty acid deficiency is the main reason to produce inflammation. India has got a significant deficiency of omega-3. Please consume omega-3. Don't consume fast food which is available. Diet and weight reduction is the need of the hour. You should eat fresh vegetables and don't have pot belly. Longer is the waistline, shorter is the lifeline. Choice is yours. Eat nuts. Don't go to fast food restaurants. They produce a lot of pot belly. As I mentioned to you, fruits, 2 to 3 servings, vegetables, cereals, and if you're non-vegetarian, you can chicken or fish. Pistachio, walnut, almonds are healthy hard nuts we must consume every day. We should never do this. No junk food, please. Don't be overweight. Overweight is a powerful predictor of the coronary artery disease and heart problems. And we see here, very important, irrespective of any belly, whether it's apple shape or pear shape, the vulnerability is very, very high to produce obesity and cause high blood pressure and triglycerides and high sugar. See, people are using remote everywhere. They are sitting on the TV, eating right everything there, and that's what is happening in India. People are becoming obese and having a high cholesterol, especially the oxidation of LDL. People are sitting in the car and calling a shopkeeper right to deliver everything in the car. It's not good. It's a real problem. Tobacco or smoking, you can't have both. Tobacco produces a lot of stress. In any form tobacco, chewable or non-chewable, is responsible. We see here the next one, that tobacco or healthy heart, you can't have both, as I mentioned to you. Don't get motivated by the advertisement campaigns which says live life in king size. Tobacco or health, very important to understand. Unfortunately, people watch the advertisement campaigns made for each other. There's no relationship. I think totally get out tobacco from our life. Alcohol in limitation, those who are used to, no alcohol or low alcohol is the need of the hour. The next slide, we can see here, alcohol increases the blood pressure or heart rate, clotting tendencies, increase cholesterol. So we must make sure that our blood pressure is normal. Please don't fall victim to hypertension and don't fall victim to diabetes. It is purely a lifestyle-borne disease. I firmly believe in laughter therapy. Laugh. Please laugh. A baby laughs 400 times a day, but an adult, not even 4 times a day. Laughter is a tranquilizer, equalizer, stabilizer, energizer, equipoiser, and happinessizer. Please laugh. Don't laugh at anybody else. Laugh at yourself. If you laugh at somebody else, you can understand what kind of problem you undergo. Laughter totally changes the chemistry. It is like an internal jogging. Dancing therapy is very good. Parikshit is sitting here. He goes to a club and there they have dancing practice is very important. Spa therapy is also excellent if you really want to manage stress. This is one of my patients. He was very stressful. And after changing the lifestyle, he's a different person altogether. We see here Adnam Sami, same thing before and after, is a different man, a person who is a singer. But what has happened? And we see here, the story here, Reliance Chief Mukesh Ambani's son, see what has happened after a change in lifestyle. So I think we have to understand obesity should never come to anybody in our house or anybody in our office. We see here, don't eat this fast food. This is what is going to be unhealthy person at the age of 3 years or 4 years. You fall victim to disease. Erratic consumption, malnutrition is the worst thing which you can see. And the guy is not able to walk here, so he is making his dog to do a treadmill. Very, very wrong. I think we need to change our mindset. We should never eat. See the woman becoming obese. And then obesity is everywhere. Central, peripheral, everywhere. And we see here the dog, we don't leave our dog also. We're giving ice cream to our pet dog, making him obese and arthritis. And we think that eating the wrong food or fast food will eliminate stress. We need to change our mindset. Ladies and gentlemen, and all the members of I, champion, I must conclude my talk by saying exercise daily, balanced diet, no tobacco or alcohol, and we should learn how to combat stress by yoga and meditation. The take-home messages are no pot belly, please. Be cholesterol fit and face this pandemic gracefully, with power, with vigor, and you should not be scared of anybody. And I'm sure we'll get rid of this panic very soon and get rid of this pandemic very soon with lowest mortality possible. Heart wellness or brain wellness will enhance our growth and productivity. We see here, we should not feel we are in a cage. Feel yourself free. I know we are in the house, we are indoor, we are in isolation, but you should not have a feeling in the mind that we are in the cage. We are a free bird, free thinking, free thoughts, and we can do a lot of stuff. Amitabh Bachchan mentioned, you become creative and the world will follow you. That's what we should do at the moment. Ethics and discipline is the cosmic continuum, the only way to heart wellness, happiness, and nirvana. Now is the time you can achieve everything. Our President of India, Abdul Kalam, once wrote, if you salute your duty, you need not salute anybody in this earth. But if you pollute your duty, you have to salute everybody. Do it now at home. And this is what Swami Vivekananda said, we are what we eat and we are what we think wherever we are. Both are expressions of our nutrition and lifestyle optimization. Thank you very much for your kind attention and giving me this opportunity to interact with you on a very, very hot topic, an important subject, how to manage stress in this era of pandemic of Corona. Thank you very much.
So, Suruchi, can we open up for question answer session now?
Yeah, sure, Parikshit. So, thank you, Dr. Chopra, first of all, for the wonderful insight about how to manage stress in these difficult times. I'm sure everyone who has attended got something out of it, and we are gonna, make sure that this is not going to. This pandemic is not going to impact us the way it has been. Thank you so much for all the information. So guys, if anyone has any question, you can unmute yourself and we can have a question answer session right now, as we have about 7 minutes left for the session.
Thank you, Suruchi.
Yes, I would like to ask one question to Dr. Chopra, sir.
Sure.
Does an systematic patient need any treatment, or they get self-cured? How can we find them?
I think I mentioned to you, so far as the treatment is concerned, I told a very statement, there is no specific treatment of coronavirus. The only treatment which has been shown in study in France, that HCQS, hydroxychloroquine, was given to the patient in the dosage of 400 milligram twice a day and 200 milligram twice a day for 5 days, and the mortality was reduced. That's how HCQS is an anti-inflammatory. It reduced the inflammation and reduced the cytokine storm. It produced the breathing distress. So this is considered as a game changer. That's how Indian Council of Medical Research has recommended this in the treatment as well as in the prophylaxis. Prophylaxis means preventive. If there is a COVID patient in your family, in your house, then one should take this as a preventive, 400 milligram twice a day on the day one, and subsequently 400 milligram once a week for 3 weeks. If you have a in the hospital or medical center, the same dosage we have to give it for 7 weeks instead of 3 weeks what we see. So this is preventive. But make sure that we don't give any HCQS to anybody less than 15 years of age. And after 55 or 60 years of age, it should be judiciously prescribed. The prescription should be on the doctor's registered pad. Nobody should go to chemist shop and buy it because the drug has got some side effects. So doctor has to ascertain who can take SCQS and who cannot take SCQS.
Thank you very much.
Thank you.
Thank you, Dr. Chopra. It is our privilege that you could join us today from your hectic schedule. Thank you very much. And thank you again for taking our time. And your presentation was fantastic with excellent practical takeaways. So thank you for your advice and guidance. Thank you very much.
Thank you, Ajay. I really enjoyed my presentation, interacting with you. This is my first presentation on the Zoom video.
Mm-hmm.
And that
okay. And I also would like to thank Parikshit that he is so kind and he supported us to invite you.
He was instrumental on both sides.
Thank you.
I would just like to mention on chat also, we have got messages from Ruhi, Sanjay and Nate where they are thanking Dr. Chopra about his wisdom of staying fit, his advice and guidance in these hard times, and the insightful messages he has shared. So thank you again, sir.
Thank you.
So if we do not have any other questions, I think we are good to close the call. Thank you so much everyone for attending the session. If you have any questions, please.
About 4 minutes. Any take-home messages? Anybody has any questions? We'll be happy to address them.
Would really love to have a chance.
Okay.
Yeah, so please go ahead.
Yeah, would really love to have a chance to discuss consciousness with Dr. Chopra, sir, on a one-to-one sometime.
Yeah, I just got 1 or 2 minutes. I must tell you today, it is the consciousness which is responsible for everything in this world. If we do everything with consciousness, it is a field of silence. It is a field of pure potentiality. It is a field of infinite possibilities, infinite probabilities. It is a field of thinker of thoughts. It's a field of idea generator. If everything we do it from the consciousness, we will never fall sick and we will always be in huge stress or a healthy stress and remain healthy at least till the age of 80 or 85. After 85, and I'm sure everything in you and me is an expression of consciousness. But unfortunately, all the time we are wandering. We are working only at the level of the mind or intellect, or we are working at the level of physical body. It is the mind which is wandering all the time, and the physical body has only energy level. It is the silence which is most powerful. But nobody understands the power of silence. And the power of silence can be achieved only by meditation. And meditation is a method which takes you to this field of pure silence or consciousness. To confuse you, I can also define consciousness as radically ambiguous, ceaselessly flowing quantum soup. In other words, we originate from the quantum soup.
Yeah, fair enough, sir. Deepak Chopra's meta-human self.
Absolutely. Boson and quartz, everything we originate from there. Whole galaxy in this world, or we see the stars, everything. You, me, animals, vegetables, we all originate. That's meta. Very good book, excellent book. So we learned, even Deepak Chopra is my teacher. I learned.
Sonal, we will take it up on another call.
Yeah, sure.
Cookie Auntie wants to say something. Cookie Auntie, thank you very much for joining in. I think you have a question. You're on mute. Ruchi, can you ask her to unmute? Can you unmute her, please? We could not hear you. Can you need to unmute your speaker? Yeah, Kukyali, please go ahead now, please.
Yeah, thank you so much, Chopra. Thank you so much for this very, very nice Zoom talk. We should have more often, and I think everybody should learn a lot because and we should practice it in our life. Thank you so much.
Thank you.
Thank you, sir.
Meenu has a question.
Yeah, Meenu, go ahead.
Hi, sir. I just wanted to compliment you. I'm a huge fan of yours, and I really love listening to you. And it was a very insightful session.
Thank you.
Hello.
Thank you.
Thank you,
Meenu.
Meenu, yeah.
Thank you, Ajay. Thank you, Suruchi, for organizing this. And we are
And
available.
thank you, Uncle. Thank you so much for your kind words and the wisdom you imparted on all of us.
Thank you very much, Ajay, for giving me this opportunity. I enjoyed every moment of it. And I'm sure Dr. Chopra will have an opportunity to discuss on different aspects. So there's still some queries about consciousness, mind, body, and I'm sure we will have an opportunity with the help of Ajay and we'll interact on this issue.
And Sanjay, we've got your message. Sanjay will just call you back. Sanjay, we've got your private message. We're just calling you. Yeah? Thank you very much, everyone.